Hi, Steve Rolnick, a psychologist, back with you today for our second meeting for the Chronic Pain Management Group. You may recall from our first session we talked about the relationship between stress, psychological and physical, and the stress response relating one-on-one to our pain response when we are experiencing pain. In this session, I want to guide you through a new pain management technique, also a stress management technique, called progressive muscle relaxation. There's a lot of good clinical history behind this, going all the way back to the 1930s even. I'm going to be doing a version of progressive muscle relaxation, during which time I'm going to guide you through the sequence of tensing and relaxing different muscle groups. It will all be quite manageable and visible. I do want you to benefit from actually attending closely to the differences in how tense muscles feel based on relaxed muscles. And I also want you to proceed with these with a slow pace. This is not to be rushed, but we will conclude this well within the expected time of this presentation lesson, perhaps 15 minutes. Okay, so let's get started. We're going to focus on our left hand, and what I want you to do is make a fist with that left hand. Study the tension in your fist. Notice your fingers going into your palm. That's not comfortable. It's not supposed to be comfortable. You want to tighten the fist only. If you notice some tightening in the rest of your arm, you want to try to focus it mostly in your hand, of your left hand, and hold that tension. It's not comfortable. You want to let go of that tension, and now you can. And I want you to let go of that tension very slowly. Wiggle your fingers as you need to, until all the tension releases and you can drop your hand to your lap as well. Now we want to do that again. Left hand, tighten it up into a fist, hold it tightly, study the tension in that hand, so much so that perhaps your arm is shaking a bit because it's so tight. And as a matter of fact, I want you to then bring your fist up and into a strong bicep muscle here. Just imagine Popeye and how he would pop out those muscles and hold those very tense and tight. This is what I want you to study. It's not comfortable. You can learn to let go of that tension, and you can do it this way. Just slightly, slowly, moving your arm, letting your fingers relax, your arm resting more comfortably on your lap. If you notice a slight warming of your left hand and arm at this point, that's a good thing. That's a sign that you've actually increased some circulation through your left extremity here. Let's move our attention now to our right hand. I want you to make a fist with that right hand. Hold it tightly. Study the tension in your right fist, the tension in your hand. Notice tension across your knuckles. Even if you're holding it so tightly, you're doing it well. I want you then to let go of the tension. Let go of it slowly. Don't move. Don't make these movements quickly, but slowly. Wiggle your fingers as needed. Rest your hand gently on your lap. Notice perhaps some temperature differences between your left hand and your right hand. Possibly your left hand might still be slightly warmer than your right. I want you to tense up that right hand one more time. Hold it tensely in a tight fist. Feel the tension across your knuckles. Bring that fist up into a strong bicep in your arm muscles. Make that arm tense so much that it's shaking a bit because you're holding it so tightly. It's not a comfortable feeling, but there's some muscle strength there that I want you to notice as well. And now I want you to let go. Nice and slowly and easily. Let your fingers unravel, and slowly rest your hands on your lap. At some point in time, people will tell me, why do I have to keep tensing and relaxing my muscles? It feels more comfortable just to keep them relaxed. Well, this is a learning opportunity to be more aware of what your body can do and what you have control over when you can sequentially tense and relax your muscles. So this is what I'm going to have you do. I'm going to concentrate now on your left hand, make that into a tight fist. Concentrate on your right hand, make that into a tight fist. Bring both arms up. Hold both arms really tensely so you can feel the strength and tension in your biceps, in your forearm, coursing down to your knuckles, your fingertips into the palms of your hands. This is not comfortable, and you want to let it go. Study the tension for a moment longer. And now let it go. Gently, easily, slowly. Let those muscles unwind, relax, resting your hands comfortably on your lap. We're going to let your hands and arms remain relaxed at this point in time. And I want you now to focus on your left foot. Press your left foot with your heel down into the carpet, toes up in front. When you do this, you'll notice that the muscles on top of your leg, your quad muscles, are going to tense up. That's a good thing. You'll also feel the pressure of your left heel into the floor. Hold that tension. Press down hard. Hold it. Hold it. It's tough to do. You're pressing down hard. You're doing a good job here. Study that tension. Now let your foot relax. Ease back in your chair somewhat. Come up a little bit on your toes of your left foot. And then rest your foot solidly on the floor. Feel the support of the floor beneath your left foot. Make sure that you get the muscles in your quads at the top of your left leg are also relaxed, and sometimes it's helpful to sort of rock up on your toes and then back on your heel. And notice the difference now on your left side with your left hand heavy on your lap, on that leg, and contrast that with your right hand on your right leg. I'm going to have you now press down hard with your right foot into the floor. Hold it. Feel the tension up the calf of your leg. Feel it on the top of your leg, your quads. Press down hard. Notice the tension there. It's not comfortable compared to the relaxation in your left leg because your right leg is tense and you're making it that way, and that's good. You're studying that tension. You're studying what your muscles can do with strength. And now I want you to just gently put your right foot down flat on the floor as need be. Come up a little bit on your toes to relax the muscles all the way up from your calf to your quads right here under your right hand. And as need be, you can move your feet forward and a little bit apart so you can feel the support of the floor again, flat to the soles of your feet. As we do this now, I'm going to have you re-practice tensing and relaxing both feet. So I want you to press your left foot hard down into the floor, your right foot hard down into the floor. Feel the tension up both legs now. Hold it in both legs. Hold it, hold it, hold it some more. And let it go. Let it relax. Notice how the palms of your hands feel on your lap at this point. Might feel some greater warmth there. That's good. Now, oftentimes we carry a lot of tension in our shoulders and neck. And that tension causes us pain. We want to be able to release that. What I'd like you to do now is First, slowly turn your head all the way to the left if you can, trying to look as far as you can over your left shoulder. Hold it in place there. This stretches and tenses the muscles here and here. Hold it, hold it. And then bring your head slowly forward position. This relaxes those muscles in the neck on that side. I'm going to have you move slowly and look way over your right shoulder too, as far as you can, studying the tension that you bring to your neck doing this. And then slowly, and this is important to move slowly, bringing it forward at this time. Okay. Sometimes then, for those of you who might experience tension headaches too, this is a good exercise. I want you to close your eyes and raise your eyebrows up as high as they can and make a wrinkly forehead here. Try to wrinkle that up. I'm pretty good at that. And then I want you to smooth it out. Just let it smooth out. You can open your eyes as you relax. I want you to, again, raise your eyebrows up tensely, tightly, and then slowly relax. Okay. I'm going to have you now experience full body tension as we do a number of these things all together, and then I'll experience the relief of the relief of your relaxation as we progress through this. So, let's repeat what we've practiced. Left fist, left hand, hold it tense, hold it tight. Right fist, right hand, hold it tense, hold it tight. Bring left arm up, bring right arm up. Hold that tension, feel that tension in both arms. Press left foot back into the floor, right foot back into the floor. Feel that tension up in your legs. Hold that tension. Bring your elbows forward so you can feel the stretch across your back. New sensation. Crunch your eyebrows up and hold your face tense. Don't grit your teeth because that might be too uncomfortable. Hold it up tense, hold it tight, and then gently relax. Take a slow breath as you do this, and let your fingers unwind. Let your hands rest on your lap. Wiggle your toes. Scan your body for any sorts of tension. Work that out. Take another slow breath from the diaphragm as we showed you in our first meeting. Study the temperature differences now in your hands. Feel the support of the floor at your feet. Feel a greater sense of muscle relaxation as you rest there in your chair, feeling more relaxed. Let your jaw go slack too if you've been holding it tight. That's important to release the tension there. And you have now just performed progressive muscle relaxation. I look forward to hearing about your experiences with this. I'm going to encourage you to practice doing this at least once a day. Don't want to rush this. This is the way to do it. Don't want you to have excessive discomfort either. But we do want you to feel confident and secure that you can learn your body better through these exercises. Thank you very much for your attention. Have a good day.